So it's kind of like fictitious, but yet we're paying, that office visit, or you're paying for that flu shot, the consumer, and that drug company, whoever makes it's making money. When the real problem, you got to fix the crate before the horse or whatever, that you got to fix the real problem. If we know that you're not going to get a good immune response, and if we take that with pneumonia vaccine, it has to probably happen with other vaccines, okay, then we need to make sure as a nation that we have a protocol and a policy that makes sure our elderly and other people who are getting immunizations are not B12 deficient. Because it makes no sense, it doesn't protect the patient, and it's a waste of money.
I get it.
So that's why I say that's, in a sense, unethical. It is unethical, because if we know this study is true, why hasn't someone or the drug companies that make these vaccines or at least them start say, hey, make sure that person's not B12 deficient? So I think it is a social responsibility or health care that we kind of work together. It makes no sense what we're doing to people. And we can also relate that, for children. We don't know the incidence of B12 deficiency in infants and children. I know there's a problem because I know there's pregnant women out there. The OB physician, I'll tell you this right off the bat, they do not do routine serum B12s on pregnant or postpartum patients. You should do it during pregnancy. We'll do a whole bunch of ultrasounds. We do a whole bunch of blood work. They have everybody on iron and prenatal vitamins, but we don't check for B12. You're not going to see a B12 deficiency because of the high-dose folic acid and coexisting iron deficiency, which is common in pregnancy, of being iron deficient, and they're already taking the folic acid. So they're not going to see that in the blood count, and the physician needs to be re-educated. It's not their fault. It's just because they need to know this stuff. That way they'll start checking. They should also, and I think once they realize the incidence, they could place them on higher dose B12. And I think another study that needs to be done, we need to really increase women with pregnancy, a protocol, what they should be taking B12-wise, and they could take it sublingually probably very well, and then see what is the incidence of autism. Is it going to go down? All these on the autism spectrum, that's developmental delay, speech problems, language problems. Those are classic signs and symptoms of B12 deficiency in pediatrics. So it makes no sense what we're doing. We're forgetting B12, and it's a total disgrace of, we've come so far. We're always looking for new advances. And I guess the major problem is there's really no money to be made in B12 because the patent has been out long ago. I mean, these drug companies, I guess, still can make some money.
Well, the drug companies are extremely interested in at least one of the Bs. They have now made it illegal for B6 to be sold independently by anybody in the whole United States. They want to patent B6. They have forbid even the Life Extension Organization from selling B6. They are forbidden.
I don't see how they could do that.
Well, they did.
B6 was made many moons ago.
It doesn't matter. They want it. They want to patent it.
Well, see, now that's a problem again with our whole legal system of how it makes no sense. I mean, it makes no sense.
Of course, it totally makes no sense, but it's a fact now.
And the problem is with that, once they get wind of that, you bet your buddy they're going to do that to B12 because someone's going to, again, everything in this world has to do around money, and it's very, very sad because it's going to affect the health of us.
Another controversial question. A lot of injections of any type, particularly vaccinations, have fillers or adjuncts in them. If there are any adjuncts or fillers in the hydroxycobalamin, what are they? Well,
for instance, there is. They put preservatives in it. In fact, I have a bottle in my refrigerator. I could read it to you, the one I use. But again, just like other drugs that we use, they have to put preservatives. Otherwise, you get bacteria, and you wouldn't be able to.
Right.
This one has each cc hydroxycobalamin acetate equivalent to 1,000. Okay, sodium acetate, anhydrous, glacial acetic acid. So they're like preservatives. There's a sticker on the rest of this, but all the drugs we give injectable, I work in the ER, we give, they have to have stuff to keep it. Now, a compounding pharmacy can make methyl B12 or hydroxyl B12, and some, I know in the autistic community, they don't want any preservatives, anything, and they put, you have to use them up by a certain day. I think it's 30 days.
Right.
and then you just refrigerate them.
Okay, and the last question, for the people that are eating lots of meat and vegetables.
Eating lots of meat or processed meat, did you say?
Lots of meat.
Okay.
Okay, steak, hamburger, fish, chicken. They have a lot of protein in their system, so they don't feel they need to be tested.
No, that's untrue. See, again, the number one reason why a person becomes B12 deficient is because of a malabsorption problem. That's my problem. When I was younger, whatever, I really didn't like, sometimes you crave what you're deficient. I didn't eat, I liked meat. I ate meat and stuff, okay? And I really wasn't keen on, vegetables as much. I've changed since then, but it's because I couldn't absorb B12. I have a condition I have an autoimmune disorder, chronic atrophic gastritis, and for some reason, my body attacks my stomach lining, and it attacks the parietal cells, which excrete intrinsic factor and hydrochloric acid. So I have like an old person's disease. I don't make any acid. I'm achlorhydric, and I don't have that intrinsic factor or the acid. And so I could eat all the meat in the world, and I was still deficient. You won't know unless you're tested. And there's different reasons. We didn't even go into the causes of B12 deficiency.
I want to go into that if you have 10 more minutes.
Oh, absolutely. The causes are, again, decreased stomach acid, which, for me, my problem is I don't have stomach acid, and it's an autoimmune disease. You had asked me earlier why are autoimmune diseases more prone. We know when you have one autoimmune disease, you're more prone of other autoimmune diseases. It doesn't mean that causes it. So, for instance, anybody who has a thyroid disorder should always be checked for autoimmune pernicious anemia, which what I have, because we know there's a higher incidence of those two together. And vice versa, because I have autoimmune pernicious anemia, the B12, I'm higher risk for having thyroid disorders, Hashimoto's, and Graves' disease. And I did have one episode 10 years ago of Graves' disease, so they're related. That's why anybody with any kind of autoimmune disease, you should always be checked. And insulin-dependent diabetes, when diabetes in younger people, that is an autoimmune disease. That's one of the reasons why diabetics should be checked for that. Because once you have one autoimmune disease, you are more risk for others. And that's what they call polyautoimmune disorders. Okay? So getting back to the causes, you can have an autoimmune disease like myself, the autoimmune pernicious anemia, decreased stomach acid, and decreased stomach acid, they know about 30% of people over the age of 55 have chronic atrophic gastritis, a withering of the stomach lining, and they don't produce enough hydrochloric acid, which we know you need as one of the first steps to absorb vitamin B12. The other reason for decreased stomach acid is, we talked about this briefly, was the proton pump inhibitors that physicians prescribe to elderly all the time, and for other people for gastric reflux disease, etc. And a lot of times they're giving these drugs when the signs and symptoms of gastric reflux disease typically is from people that don't have enough stomach acid. So on these drugs, we chronically see people are B12 deficient, and they're not giving them B12 or testing. If you have H. pylori, which is a bacterium, it competes and it can eat up your B12 stores in your stomach. And a lot of times when people get endoscopies, they check them for that organism. Anybody who's had a gastrectomy because of cancer, ulcer disease, or a gastric bypass for weight loss, those are causes of B12 deficiency. Intestinal resection from cancer or Crohn's disease, they take out when it's really diseased, they'll take out the intestine. You're going to get a B12 deficiency if the ileum is affected. Any kind of malabsorption syndrome, which again is Crohn's disease, even if they didn't do surgery, because that lining, you need the lining to absorb B12 properly. People who have celiac disease, which is gluten enteropathy, again, you get malabsorption syndromes. People with chronic pancreatitis, bacterial overgrowth of the small bowel, very common in elderly patients. People have, these are more rare, but fish tapeworm causes B12 deficiency, alcoholism, and malnutrition. People who just aren't eating enough B12, and eating disorders, bulimia, anorexia. Those people get B12 deficiency. The vegetarian community always are at higher risk. Doesn't mean they're going to have it. If they supplement properly, they won't have a problem, but they should always be screened, especially, we have to really make this clear to OBGYNs. If you have a pregnant person in pregnancy Anybody, they should ask these questions, and that's the problem, that nobody's asking. Vegan, vegetarian, every pregnant woman should be screened, but especially